A labor dispute is heating up as some employees at Children's Hospital say they can't even afford health insurance for their own children. Good evening, I'm Susan Farrell sitting in for Gloria Penner, and tonight we'll look into the standoff between management at Rady Children's Hospital and a union representing workers who say they're the lowest paid at the hospital. Also, how are county animal shelters handling the overpopulation of unwanted pets? Are efforts to limit the numbers of animals being put to sleep working? And we'll also introduce you to the unique history of Koreans who fled a military invasion of their own country, only to find a life of hard labor in Mexico. Eventually, some settled in Tijuana. We'll hear their stories tonight. But first, these headlines. A bill allowing illegal immigrants to obtain California driver's licenses has passed the state Senate, but the measure's chances to become law are slim. Governor Schwarzenegger is expected to veto the bill. The San Diego County Taxpayers Association Board has voted to oppose moving San Diego's airport to Marine Corps Air Station Miramar. A measure asking voters to approve the Miramar site will be on the November ballot. And the way California ballots for president are counted may change. The state legislature has passed a bill that would give California's 55 electoral votes to the winner of the national popular vote, instead of the top vote getter in the state. We turn now to the labor dispute at Children's Hospital. On this Labor Day weekend, some employees at Rady's Children's Hospital will be preparing to picket the hospital. These workers are among the lowest paid at Children's and for 2 years have been trying to negotiate the first contract between the hospital and the Service Employees International Union. Here to talk about the labor standoff are Renee Sebeny, the lead organizer, for the SEIU, and Cynthia Tavares, a medical assistant for Children's Hospital, who is on the negotiating team. Welcome to you both. And before we get started tonight, I should note for our viewers that we invited Children's Hospital to send a representative, but they declined. They did provide us with written information on the negotiations. So, Renee, let's start with you. Tell us about Service Employees International Union. Who do you represent, and what are you trying to achieve at Children's Hospital?
Well, we're a healthcare workers union, and we represent 140,000 healthcare workers in the state of California. At Children's Hospital, we represent about 680 employees who are the support staff. They are the CNAs, the housekeepers, the maintenance mechanics, most of the support staff.
When you say CNAs, what is a CNA?
A certified nursing assistant.
All right. And what you're trying to do is create a first ever contract. Mm-hmm. Why now?
Well, actually, over 2 years ago, employees at the hospital, some of the secretaries, employees at the hospital, called us and said, there were some really serious issues that they wanted to change at the hospital. And so that's the reason that we started working with them, is they decided they wanted to form a union to address some of the issues that they had. In high turnover of staff, they wanted to be able to better recruit and retain qualified staff. They also wanted to improve the benefits and wages, where there's employees at the hospital right now who get capped out and don't receive wage increases. They can spend 10 years working at the hospital without receiving a wage increase. So those are some of the problems that employees wanted to address by forming a union.
All right, this has gone on for 2 years now. Why so long?
Well, that's why we're here. I mean, the problem is that, we've been, in negotiations. Cindy is on the bargaining team, and it just, the hospital has refused to agree to some very simple improvements that employees have been asking for over this period of time. At this point, the employees are asking for, this last July they received a raise, and the employees are saying all employees deserve to get a raise every year. The cost of living goes up every year. Employees deserve to get a raise. That's one of the key issues. And the hospital right now will not recognize, will not agree to provide all employees with a raise this year. So that's one key issue. The other thing is that they haven't agreed to a real patient care committee where, employee healthcare providers can have a say in how the decisions are made about how to provide care for their patients.
The hospital has indicated in a memo to employees, the information that they provided to us, that SEIU is taking its time in getting back on some of the offers that they've made and frequently increases demands to the hospital after an offer has been addressed. What do you say about that?
Well, I think we should ask Cindy. She's on the bargaining team.
I don't think that that's true at all.
Cindy Tavares, you are a medical assistant.
I'm a medical assistant.
And you do what? What's your role at that?
I am a medical assistant. I work for Children's Hospital. I work at the Polinsky Children's Center. When the children come in then they're brought through the process and they come in through nursing. We do their vitals and checkups and immunizations and anything that the kids need.
So you deal with children who are really special needs. They've been taken away from
the parents
for some reason.
Or a family member or something. It's children who are abused or neglected.
All right, so what do you say? You've been on the bargaining team. You've been part of the process. How does it go? Tell us what happens when you go into a bargaining session.
One of us either propose an offer or have a proposal that we want to give to them. We will discuss it and go over it, and we will give it to them, and we'll sit across the table from them. They'll leave and they'll discuss it with themselves. They'll come back and they'll say no, or they'll say this is our last offer, or it's too much, or eyeballing this, it's too much. And so we've come up with a proposal that is as much as they're willing to spend. It was like two. I'm not sure how much.
You're talking about the total package.
Yes, ma'am.
Children's Hospital has provided us with information which says that the total package of what they're offering you is $2.2 million over their current budget,
yes,
their current salary budget. Is that correct?
They're not offering that to everybody. They're not offering that across the board. They are leaving a big group of people out of this.
Again, in the information they have provided us in response to that, they say that there's a very small group of people who are not included, and they are not included for standard reasons that are part of employment. Perhaps they didn't qualify for a raise, or they didn't get a good review or evaluation, that kind of thing.
Their raises that they give are based on merit raises, and they score you on your job. And a lot of places it depends on who you work with. Somebody might not like the way you did something. Somebody might really like the way you did something. So that's going to score higher or lower on your evaluation and affect your raise. So some people might have got a 2% or a 3%.
Let's talk about pay and use you as an example. Now, you've been there how long, and what was your starting pay, and how are you doing now?
I've been there for 7 years. My starting pay was maybe almost $10, and now I'm up to $13.62 an hour.
And the offer that Children's has on the table is starting everyone at $10?
They're starting the minimum wage at Children's for $10, so if you're not making $10, you will be brought up to $10.
And what is SEIU's main? What's the main sticking point? Let's put it at that.
I think the issue that Cindy just brought up is really important, because we actually just had negotiations yesterday, and the bargaining team has made a lot of really important compromises. And really, they're looking at how do we have a contract? How do we win a contract here, where all of the employees will benefit and everyone can be guaranteed a wage increase every year? Right, affordable health insurance, and a voice in the decisions that are made about how they provide patient care. And the truth of the matter is that based on the information from Children's Hospital, July, when the employees received their raise, 20% of the employees did not receive a raise. And the majority of them did not get a raise, not because they didn't meet proficiency standards or some standard set, but the majority did not receive a raise because they were capped out, meaning they had too much experience and they had reached the cap for that job class. So basically the hospital makes a determination that an employee no longer is eligible for a raise because they have too much experience.
Children's has said that they take in a much higher percentage of under or uninsured patients than some of the hospitals with which they're being compared. And as we say, that current wage offers, they say $2.2 million. What does SEIU think about that, and how the hospital could pay for the increases that you want, the across-the-board increases?
So the hospital just announced, actually last year was their best fiscal year ever. They announced in the Union Tribune that they made $32 million in profits last year. So that clearly the hospital is making a large amount of profits.
They have noted. Let me sorry to interrupt. They have noted that much of that is from the Rady donation, the $60 million donation. For expansion.
Right.
No,
right.
Not
that's
necessarily.
That $60 million is aside from the $32 million. You're absolutely right. Ernest Rady donated $60 million for expansion, and there was $32 million in profits they made last year. But that's not the only issue. The issue is that we believe the employees, that the hospital is underinvested in the employees for the last few years. So this $2.2 million is a huge breakthrough. We feel really good about the fact that the hospital is starting to recognize some of these issues, and make improvements in their offers. That's the really good news.
All right. In the few seconds that we have left, I would ask each of you, where do we stand? How close are you to beginning the picketing on Wednesday or not? Do you think there's going to be a breakthrough and we'll settle, or we'll see
No,
picketing?
I think there's going to be a definite picket. We've already got many people who have agreed to come to this, and we've got many people who will show up for this. The picket will happen.
So Renee, you're too far apart in the negotiating to think that you would avoid the picketing.
Well, I mean, I think the hospital made that decision yesterday in negotiations because we made a large compromise and gave the proposal to the employer, and what they came back with is no and no explanation. And so they left us, really, the bargaining team, with no choice.
No choice.
Thanks very much, Renee Sebeny and Cynthia Tavares, for joining us today. Coming up next, saving unwanted pets. The overpopulation of unwanted pets and animals is a big and expensive problem for San Diego. The County of San Diego spends $12 million each year to run its 3 shelters. Shelters which took in more than 26,000 animals last year. Tonight, we'll explore the problem and what's being done to reduce the numbers. My guests are Dawn Danielson, Director of the County Department of Animal Services, which oversees the 3 county animal shelters, and Candy Schumann, Director of the Spay-Neuter Action Project, or SNAP. Welcome to you, ladies. And we have obviously many big issues here, but the biggest is 26,000 unwanted animals last year. Dawn, tell us, what kind of animals do you take in? How do they get to you?
Well, we take in everything: dogs, cats, horses, llamas, reptiles, you name it. That flies in, walks in, slithers in. We get them, they're brought in stray. We seize them in animal cruelty cases. Sometimes they've bitten people, and we have to they come in a variety of ways.
A few years ago, animal support groups and the Department of Animal Services were barely speaking the same language. What was called animal control at the time was looked at by many people as the enemy, bent on destroying harmless animals to make more space. But now it's turned into a virtual love fest. And while the new shelter and the new Humane Society have a lot to do with it, the bigger question to you, Dawn, is what did you do to turn it around? Because support groups say that you're key here.
Well, I can't take all the credit. It was staff turned around. We figured out Michael Haas came on for a couple of years too. And basically, this community will not tolerate surrounding the wagons or the bunker mentality. And basically, it was sitting down and talking to people and acknowledging that we all have the same goals. Maybe we differ on how we get there, but we all want the same thing. We want to save animals, and that was key.
Well, and in the past few years, we've seen a dramatic drop, 8,000 animals less coming into the shelters. And Candy, SNAP and other support groups have obviously played a big role in this. What does SNAP do? How do you help keep animals out of the shelter?
Well, our main mission is prevention. So what we want to do is provide outreach, educational outreach, and access, spay-neuter access to everybody at an affordable price, so that the animals don't get into the shelter in the first place. And the education that we provide is everything from compassion, responsible care, dog bite prevention, what shots the animals need. We refer people to various resources in the community, things they just don't know about, so that they get connected to their animal.
Well, connected to somebody like Cookie. Tell us about Cookie here. Tell us about your buddy. What's his story?
Well, Cookie came from Chula Vista Animal Control, which is one of the shelters that still has a very high population, and they're working very hard on reducing the impounds. And this last July, knock on wood, they had the first reduction ever, a 2% down from last July. But most of their dogs come in as strays, and people don't claim them. And they're darling dogs. They're just loaded with wonderful, wonderful dogs. So Cookie was at the shelter, and I had a second hold on him. I was looking for a little dog. My other smallest dog had a heart attack, and he was just scared to death. And I was lucky enough to be able to adopt him. And we're happy with him, and he's happy with us.
Well, and San Diego is known as one of the areas that has what's called a no-kill policy. How does that work? How do you determine, 26,000 animals a year, that's a tough challenge. Dawn, how do you determine?
Okay, first of all, we're trying to get away from the term no-kill. Most of the public really doesn't understand it. When you use the term no-kill, they think no animals will ever be euthanized. that's not correct. Animals come in severely injured. All the money in the world would not save those animals. We have also dogs that might bite people that are not safe. We don't want to put them out in the community. But with that said, our friendly, safe, healthy animals fall into that adoptable category. Age doesn't matter, breed doesn't matter, the length of stay at the shelter doesn't matter. Those are the group of animals we want to protect. The next group are our treatables, the ones that need medical treatment. And that's our next goal, to save more and more of our treatables.
And keeping them with their families, such as this couple here, meeting with a staff person, learning about the animals. You let people know about the animal and what its needs are, too, not just the people who want a pet.
Exactly. We try to learn about people's lifestyles. What are they looking for? If it's a jogger, they don't adopt a basset hound. That's not going to work, okay? So it's getting the right fit. We don't just want to adopt them, we want them into a new home for the rest of their lives.
Tell me about the numbers. This is a specially little cordial cat you were talking about. They're quite the charmers. Your numbers are up. They're good. You're having a success story here,
Yes.
but not the success you want.
Right. Dogs are great. 80% of all the dogs coming into our shelters leave. Either they go back home to their original owner, they're adopted to a new home, or our adoption partners or rescue groups take them into their programs. Cats, it's a different story. Our save rate for cats is only about 56%. Now, 6-7 years ago, it was like 20%, so we've made great strides. But people have not gotten the message about spaying and neutering their cats. A female kitten at 4 months can have kittens. It's kittens having kittens. We get in 34 kittens a day between Memorial Day and Labor Day, and these are kittens without moms that are still nursing. We do not have the resources to support those bottle babies, so unfortunately many of them have to go down.
Candy, when the people from SNAP go out and try and educate would-be pet parents on things, what's the one thing that you can say to them to get to them to spay or neuter an animal?
A lot has to do to help them to understand what the health benefits are for their animal, for one thing. A lot of people don't know that.
Doesn't make them fat and lazy, doesn't make them...
No, and it reduces risk of cancer, it reduces risks of injury, especially with male dogs that are out running and getting hit by cars. 75% of the dogs killed on the roads are unneutered male dogs. I don't know what the percentage is of unaltered dogs, the strays that come in, but it's what, in the over half of them, of the dogs that come in as strays are unaltered dogs.
They leave altered.
They will leave fixed, yeah.
Those animals.
And I just would like to interject, when Dawn talks about an 80% save rate on the dogs, that is really remarkable. I mean, there are limited admission shelters that don't have rates like that. So for a pound to have that kind of a success rate is really huge.
But we couldn't do it alone. It's the community, it's the resources that are helping us do that.
And speaking of those resources, tick off for me quickly, if you would, Candy, what SNAP offers to a potential pet parent.
Well, we have a few different things that we do. We've got 2 lines. One of our lines is just a general information line, and that's 619-525-3047. We will do referrals to private veterinarians who offer reduced spay-neuter rates. County Animal Services, for their jurisdiction, also has a rebate voucher that we can distribute to people that have a little extra need. The bus line is primarily we want to reserve the bus facility for our low-income people that we are subsidizing basically their capability.
So you'll help them with that. You'll help people with that.
We charge $5 for cat spay and $15 for dog neuter, and with the dog neuter, they will also get a free rabies vaccine and a license from both County Animal Services and Chula Vista. We have an arrangement with them.
All right, we just have a couple of seconds left. Dawn, what's the message you want people to have? Because all of your challenges are controlled by people, aren't they?
Absolutely. Spay and neuter your pets, license your dogs. If you adopt a new animal, do it for life. We don't want them back.
All right.
Keep them home.
Good point. Dawn Danielson, Candy Schumann, thank you so much for coming in and helping us to, we hope, educate some folks and some potential pet parents.
Thank you, Susan.
Thank you.
Coming up next, a blending of East and West. It's a part of Mexico's history which has been kept secret from the rest of the world until now. A century ago, hundreds of Koreans were imported to Mexico to toil at heavy labor on plantations. Today, some of their descendants are living in Tijuana and keeping their past alive. Elsa Sevilla brings us the story.
In 1905, 1,033 Koreans, men, women, and children, made a treacherous journey across the Pacific Ocean in this ship. Months later, they would arrive in Oaxaca, Mexico, then transported by train to Mérida, Yucatan, under a 4-year worker program. Some came to Mexico looking for new opportunities. Others were fleeing the Japanese-Russian invasion of Korea, but they could never imagine the sacrifices they would be forced to make thousands of miles away from home.
It was difficult because in the first place of the weather, the food, they were not familiar, and then they didn't know that it was so hard labor that they had to cut with a machete, and they have to cut the leaves, and it has a lot of thorns, very pointed like needles, so their hands would bleed.
Lili G. de Bañales talks about her grandparents living and suffering in a foreign country. Those who refused to work were jailed and sometimes beaten. Her grandmother was one of those laborers harvesting the eniquén, a cactus-like plant in southeastern Mexico. Fibers from the plant were used to make rope and other items. Lili's cousin, Pedro Díaz, remembers the early days.
They would go very early to the plantation. They would get up so early in the morning because the sun was so hot. They would only work until 10 in the morning.
Looking over pictures brings back memories of the life their grandparents once lived. Because of the language barrier, there were many adjustments to make.
They changed the names at the crossing the border, like the aduana customs, because they would say, what is your last name? And they would say, E. There is no such last name. So we all changed our names.
More than 30 years later, Lili's mother, Elvia, would be the first Korean to move north to Tijuana, opening a shoe store. Lili was the first Korean born there. Others would soon follow. Pedro still lives across the border.
Yo llegué a la edad de 14 años a la ciudad de Tijuana en el año 1944. We lived in Quintana Roo and moved to Tijuana when I was 14 back in 1944. My parents moved here looking for new opportunities.
They continued to honor their heritage by preserving traditional costumes and photographs from that era. They also celebrated the centennial of the Korean migration to Mérida, Yucatan last year. Many Korean dignitaries attended to honor and remember those who made the voyage a century ago.
We didn't even expect to have our grandparents treated as heroes. They built a statue in honor of the Koreans. The president of the National Assembly in Korea came and donated $1 million to build a hospital in Mérida.
Keeping their history alive and staying connected, the community of Mexican Korean Americans honors their past with traditional Korean dishes at a family reunion in Chula Vista every year. 92-year-old Sabina Corona King was one of the first Koreans born in Mérida.
Muchos hacen esa pregunta porque me ven que soy oriental, ¿no? Es lógico.
Many ask that question, how do you know Spanish so well? Because we are Korean Mexicans, I was born in Mexico.
Estudié en México, le digo, por eso le digo.
What began as a worker program or a way of escaping the oppression in their native country turned into an odyssey for more than 1,000 Koreans. What's most important to these Mexican Korean Americans is preserving history, so that the new generations will remember where they came from.
I'm very proud to have been born in Mexico background. I'm very proud to have been Korean. Now that we are here in the United States, I'm very proud that my children were born here in the United States.
When the worker program ended, many Koreans would never return to their homeland. There are now some 40,000 descendants living throughout Mexico, Cuba, Hawaii, and Southern California. That's tonight's Full Focus. We'll discuss tomorrow the pretrial hearings of 2 Camp Pendleton-based Marines charged with murder in Iraq, and we'll talk about why Father Joe Carroll is cutting services to the homeless. For KPBS, I'm Susan Farrell. Good night.
This program is made possible by the members of KPBS and our program underwriters.
The overall impact that is important to us is hoping that other people will say, this is a great idea, let's support this, let's get behind it. Find your own reason and make it happen for somebody else.
San Diego Magazine covers everything San Diego: dining, entertainment, real estate, and more. Your city, your life, your San Diego Magazine. Monthly issues available on newsstands, sandiegomagazine.com.
Procopio, Corey, Hargreaves & Savage is celebrating 6 decades of growth and investment in San Diego.
We like to invest our time
and resources back into our